Hey guys, I want to talk to you today about anxiety, generalized anxiety, social anxiety, specific phobias, and we'll be talking about all of those today. The first I want to talk about is generalized anxiety. Generalized anxiety is a fear of just anything and everything that's important to you. So it could be your finances, your job, your children, pretty much anything that comes across your mind frequently. This is the most common form of anxiety that we see. It's very prevalent. The next form of anxiety I want to talk about today is social anxiety. That's where a person gets around other people and starts to feel very anxious. It's usually a fear of failure or a fear of being ridiculed by others that drives social anxiety. And it's quite common, but not as common as generalized anxiety disorder. People with social anxiety disorder struggle with public speaking or just hanging out with crowds in general, especially people they don't know well. Another anxiety disorder that I failed to mention earlier is panic disorder. This is where a person gets panic attacks frequently, at least once a month, and they've caused a disruption in their day-to-day functioning. So they've changed some routines due to these panic attacks. It's just it's causing them a lot of distress. And panic attacks, of course, are where you have a rapid heart rate, might feel dizzy, trouble breathing, sweating. There's a whole host of symptoms, but the main symptom is a fear of losing control or that someone is actually dying. The fear is that intense, so it's really, really strong anxiety attack. People can have panic attacks and not have panic disorder. That's where a person just has a panic attack maybe once every couple of months, or they have, more frequently, but the panic attacks don't cause a disruption in their day-to-day functioning. The last form of anxiety disorder I want to make sure I cover today are specific phobias. This is where a person is afraid of a specific thing. It might be spiders, heights, could be enclosed spaces like claustrophobia. That's the name for that one. These fears only exist when the person is exposed to that cue or object, and it's quite they're quite common and um, just not as common as generalized anxiety disorder. And it just depends on the person as to what they are afraid of. And typically, these are caused by traumatic experiences with those subjects. So, the person might have a fear of dogs, probably because they were exposed to a large, angry dog when they were young. And so they've developed that phobia over time. When it comes to treating anxiety disorders, there's a couple of great strategies. The first one is cognitive behavioral therapy. It's where a person will learn coping skills like deep breathing, meditation, relaxing activities to help reduce their anxiety. They'll also learn some cognitive techniques, which are relaxing thinking, focusing on relaxing thoughts to help them better control their anxiety. Another treatment is exposure therapy or prolonged exposure therapy, where a person is exposed to those cues that cause their anxiety. This is great for people suffering from social anxiety or specific phobias. You get exposed to the thing that causes you the distress, and gradually you start to see that you can handle more and more of that. Lastly, and at last resort, are medication options. So typically we treat anxiety with SSRI medications or SNRI medications. Things that help with depression and anxiety are taken once per day and help to significantly reduce a person's symptoms. If anxiety symptoms persist, like panic attacks, a person will typically go on something to help as needed, like a blood pressure medicine, or even in severe cases, a benzodiazepine like Xanax or Klonopin. Well, thank you guys for watching this video all about anxiety. I hope it was helpful, and I hope that you will continue to watch these videos. Have a blessed day.